Zimbabwe has been hit by a severe influenza strain which has been identified as an ordinary flu variant by the Ministry of Health. Over 4,000 cases of flu have been recorded inside 1 week. Health experts have already warned those with underlying conditions to take precautions such as good hygiene practices, avoiding crowded places, wearing face masks and keeping warm. We spoke to medical practitioner Dr. Mishigruwende on this issue.
It's just flu. We haven't had any information from the Ministry of Health or any other ministries or related ministries around the region saying otherwise, for example, saying that it's COVID. I know the flu is very painful and it's, usually flu usually goes for about a week, but this one is going up to even for 2 weeks. But what we know so far is that it's just flu, nothing much. It's just a flu that's more painful. Looks like it's a COVID that made it the normal flu and then it gave us this flu, but really it's just flu.
Dr. Ruende also added his voice on the much-hyped flu vaccine.
Vaccine hasn't been that common in this side of the world, the southern African part, including Zimbabwe, but really in other developed countries, the Western countries, Europe and so forth, they have always been using these vaccines. So there's nothing wrong with the vaccines. I know the hype, yes, but I encourage people they can have it. There's no problem with that. In terms of its effect, it's quite effective, in fact. But I still believe even on top of the vaccine, people still need to practice the general preventative measures, which are the ones we mainly learned from the COVID-19, including the social distancing, always washing hands after sneezing, after shaking hands with others, and so forth. And when we are coughing, that is, you want to prevent it to the next person, coughing on your elbow, not on open palms. And other probably you can even use a tissue and then you throw it away. So those preventative measures, we still need them on top of the vaccine.
He also recommended several measures to deal with the current wave of flu.
My advice to go to number one, the one with flu, just the same as somebody with HIV, like I always say that if you have HIV and I'm not aware of it, but prevent me from that. The same thing with flu. If you have flu, but flu is usually more transmissible during the first days, even before you get the symptoms. So, number one is if you have flu, make sure that you prevent the next person from getting the flu. Staying away from that person, social distancing, and also making sure, like I've already said, when you're coughing, you cough in your elbow or on your tissue, then you throw it away. If you're sneezing, again, the same thing. Always washing your hands. And then to the other part, again, always the receiving person, making sure that we stay away from people with flu, especially people with asthma, because they can easily tip into pneumonia and other complications. The other group of people that needs to stay away from people with flu are people with chronic conditions like HIV, diabetes, hypertension, that is high blood pressure. Those people are at much higher risk of developing things like pneumonia, which may put them at risk of dying. So those are the main issues. And then once one develops flu, what's important is rehydration.